Okay, here we are at Universal Dermatology, and Erica, our medical esthetician, is doing a microneedling. Can you tell us a little bit about this, Erica?
So microneedling is really great for fine lines, pore size, collagen production, acne scarring, tightening of the skin. It really does a nice job with production of collagen, so you get a lot of added benefits from this. It also is pretty comparable to doing some laser procedures with very little downtime. So as you can see, she's a little bit red. This redness will die down in about 24 hours. She's not feeling any pain while we're doing this. And in about 3 days, her skin will be back to normal.
So, Rachel, you've had how many of these treatments?
I think this is my fifth. I believe my fifth.
And have you noticed a big change in your skin?
Absolutely. The before and after pictures are amazing. It's filled in a lot of the pores and little crevices that I had in my skin for the acne scars. And it's improved my overall texture.
And what about the pain?
There is no pain. It in fact tickles in some of the areas.
Okay.
From vibrations. That's all you feel.
And then how would you describe the downtime, the after effect? What do you look like?
I'm red like a sunburn, and you kind of feel like a sunburn for the first day and maybe part of the next morning, and then the redness just goes away. And it only takes, like she said, about 24 hours for the redness to go away, and you're right back to normal.
Great.
She has a little bit of pinpoint bleeding here. That's actually completely normal, and that's what we want. That way we know that we've hit the area where the collagen is produced, and we're stimulating the collagen. So that's completely normal, and that pinpoint bleeding will actually stop in about 5 minutes.
So this pin that you're using, how many needles does it have? How deep do you go?
This actual pin has 36 needles in it, and that's the one that we use for the face. If we're doing scarring, we have one that has 12 needles in it, and they're a little bit thicker to break up that scar tissue. This pin can go up to 3.0 millimeters. And what that does, it really depends on the patient as to how deep you go. You only need to go until you get the pinpoint bleeding, because that's where your collagen layer is, and there is no point in going any deeper than that. It only causes more irritation to the skin and more downtime for the patient.
What about, are there other areas of the body that you can do this on other than the face?
You can actually do this anywhere that you have any type of acne scarring. Some people have acne scarring on their backs, on their chests, some people even on their arms. It does not work very well for stretch marks. I know a lot of people advertise it for stretch marks. I don't find that it does a great job for stretch marks. So anywhere that you have texture that you want to improve, fine lines, loose skin, acne scarring, you can use it anywhere.
Now, what's the skincare regimen after she has this done? How is she going to?
So her skincare regimen, she's actually going to go home with today. It has a gentle cleanser, a gentle moisturizer, of course an SPF, as well as a spring water, which helps hydrate the skin. It also helps with cooling the skin. Sometimes you feel like you have a little bit of a sunburn afterwards, so this will help with that sunburnt feeling. The sunburnt feeling only lasts about 2 hours. So all of that she'll go home with. She'll use that every day, twice a day for the next 3 days, and then she can go back to her normal skincare regimen.
Now, just to clarify, she did put on a numbing cream before this, correct?
We did put on a topical numbing cream, and that sat for about 45 minutes, and there's no pain involved with that. It feels a little bit tingly, in fact. Would you agree with that?
I do.
We wipe off the numbing cream, and then we can do the procedure.
Okay.
I could go to sleep.
All right. Well, I think that's gives our patients a good idea of what microneedling entails. Anything else that either one of you would want to add?
We're going to have a great special for our 12 days of Christmas on microneedling. We typically recommend 3 treatments of microneedling for best results.
And how far apart are the treatments?
Typically 4 to 6 weeks. I
Okay.
like to stay anywhere, whatever's best for the patient in 4 to 6 weeks.
Perfect. Okay.
So our special will be buy 2, get 1 free.
Great.
It's a great deal.
Thank you so much for your time.
Thank you.